Now, I know, especially these days, a lot of docs are packing a lot into appointments. Um, so parents may receive a referral to an ENT without a lot of explanation why they're being referred to a specialist. What are some typical reasons why a child who has asthma or who may have asthma could be referred to you?
I would say the more common things that I see have to do oftentimes with a cough. Now, a cough can be a symptom of a viral infection, a cough can be a symptom of allergies, a cough can be a symptom of asthma. It can also be symptoms of acid reflux, or sometimes in the sleep, even obstructive sleep apnea. And those are all disorders that we have a hand in diagnosing. In terms of coming to the ear, nose, and throat doctor's office, one of the things that pediatricians and pulmonologists will oftentimes request from us is a thorough evaluation of the upper airway, sometimes including office procedures to look at not only the nasal cavity, but the back of the nose where tissue called adenoids sometimes sit. And we can also look at the voice box, and that's a procedure called laryngoscopy. And so it gives us a full view of everything kind of affecting the upper airway that could even transmit to the lower airway. So I would say we tend to see patients who are being worked up and considered for that diagnosis, or sometimes having difficult symptoms to treat, and to see if there's something that we can explain in our area that's a trigger or provoking things.
Now, a lot of people, the first thing when they hear ENT specialist is surgery. If a child has been referred to an ENT, does that mean that surgery will be involved?
No, not necessarily. And one of the reasons, as I had already mentioned, is that sometimes these are the children that may be on the younger end of things, maybe under the age of 6, and they're manifesting some wheezing and cough symptoms that haven't yet fully been diagnosed with a true asthma, and they're considering it. So sometimes it just involves us kind of assisting in making the diagnosis. Acid reflux is commonly overlooked in children as a reason for cough, or even small amounts of acid reflux that can get into the windpipe and worsen asthma. And so sometimes that's just medical intervention and medical therapy, but we can play a key role in diagnosing it by using our office-based procedures. So while there are many problems that we deal with that do require surgery, I would not say that all patients coming to an ear, nose, and throat specialist should expect it.